and welcome everybody. Thank you for joining us at tonight's roundtable, Healing the Healer, as presented by TV Asia and the American University of Antigua. This is a series of streamed roundtables bringing discussion to you on pertinent and concerning topics. My name is Prem Kumar, and I'm the advisor to the President for Special Projects at the American University of Antigua. Today's discussion, Healing the Healer, the WHO and United Nations mandate that caring for the mental and physical health of the frontline and medical staff is critical, has resonated very well with us, being a medical school with our students as your healthcare proxies. This has been picked up around the world. As always, we like to keep abreast of topics that are current. AUA alumni in the field are here to speak their viewpoint, as well as we have Dr. Shah from UK to give us his perspective on what's happening across the waters. So let's start with Dr. Samir Shah from the United Kingdom.
Hello, everyone. It's fantastic being here today. I'm Samir. I'm a consultant psychiatrist and medical director in one of the very busy psychiatry hospitals in the UK. And I'm here to talk to you all about the topic today.
Dr. Matthew.
Good evening, guys. My name is Ashwin Matthew. I am an interventional cardiologist at Temple University in Philadelphia, Pennsylvania, and I'm looking forward to talking to you guys.
Dr. Panishri Rao.
Hi, everyone. My name is Dr. Panisri Rao. I am a family medicine physician as well as public health practitioner located in Pennsylvania, working for WellSpan Health.
And we have Dr. Tara Nazareth.
Hello, everyone. I'm Thara Nazareth. I am a PGY4 resident in Jamaica Hospital Medical Center in New York and practicing psychiatry.
From starting medical school to where you are now, the medical school grooms you to be more than just a medical doctor. However, the pandemic has put a completely different twist on how medicine is being practiced and what you all are having to face now in your day-to-day practice. As Dr. Stephen Covey has said, with the end in mind, this is not always the case. Let's start at the beginning with our alumni. We know how proud you are of your university, and all I have is one question for you. Do you think that your academics and your rotations and all what you learned from AUA has stood you in good stead in the past 22 months? Let's start with Dr. Nazareth.
Honestly, I'm not sure anything could have prepared us for this. This is something that is really unheard of, unseen. But the skills that you learned from being on the island and then being in your rotations have really brought forth and been used to the maximum capacity during this time. Our goal is to help, to heal, and to stay healthy ourselves. So really, we use all the things that we've learned at AUA to provide the best care that we can.
Dr. Matthew.
I agree with that sentiment exactly. Also, the determination and perseverance it takes to be successful when you're in a Caribbean medical school or in that setting, I think that also helped us during this whole process. It really taught us that, with hard work and focus and really just taking care of patients and that desire to take care of patients, you can be successful throughout this pandemic. And although the war's not over, we've definitely made great strides in taking care of our patients.
And Dr. Rao.
So I do agree with both of my colleagues here. AUA did offer and continues to offer quite a robust and sound curriculum, which is offering our first foundation into medicine. So I do believe that not only from the beginning, but through and in terms of having the experience of being on the island, having the experience of learning independence, being away from family and home, but having more family to attain on the island, into the clinical rotations absolutely helped prepare me, even being done over 10 years ago, into a pandemic of this proportion.
And Dr. Shah, I know you're also an IMG, even though you've been, out of school for a very long time. What would you say to your alma mater?
Oh, well, I think just as some of the colleagues and panel members have said, it is very difficult to prepare for something that was not even dreamt of or thought of. However, we do have history from the past, whether it's swine flu or many other pandemics. The challenge we face this time is, are we using those learnings in our medical school so that we are prepared for other areas as well? So, yes, my alma mater, which I graduated from KM Hospital in Mumbai, did prepare me on many levels. But again, this is just unprecedented. So, it's always refreshing to hear AUA. People who have graduated from the field that they are prepared to a level. No one can be 100%, but to a level where they feel comfortable enough in their skin to uh, take on the challenge.
With the hospitals and the community stretched thin, be it the nursing staff, be it the support staff, and of course the doctors, the COVID-19 has placed an extraordinary amount of stress on all health professionals and the support staff. Self reported mental health symptoms, burnouts, depressions, these are the things that we are hearing, which is frightening. Um, I would like to get a perspective from you as to what you are seeing among your colleagues, among the hospitals where you are attending or a consultant. What are you seeing? Dr. Matthew, let's start with you.
So yeah, burnout has been a serious problem amongst a lot of our colleagues. I think first and foremost, I think colleagues that are closer to their retirement. I've seen multiple colleagues that had hoped to work 3 to 5 more years have decided that it's not worth it. They can't handle this anymore. So that has been a huge problem, which is a sudden decrease in the workforce, which leads to a lot of shortages and things like that. And that can be physicians or other staff members, support staff, anything. The other thing that we've seen is people are mentally drained, and there's others that are looking for alternative careers. I've had a couple of colleagues that have gone into industry to work for pharmaceutical companies because they just can't, don't want to deal with this burnout anymore. I think the burnout was real, and people are looking for alternative options to make them feel more fulfilled and satisfied with their careers.
Our roundtable, Healing the Healer, will take a short break and return shortly to continue this very exciting discussion.